Good morning, friends. I have no financial interest in this lasers, what I'm going to discuss. My topic is femtosecond lasers in refractive surgery. The question which comes to our mind is, we all used to microkeratome. It does give very good results, very safe. But why do we need a femtosecond laser? One is safety, the precision in which it does, it's versatile. It could be a corneal surgeon scalpel, and it's definitely for more patient comfort, and when you talk to the patient for counseling, probably less frightening. When you say versatile, it can make flaps, it can make standard flaps. Many machines can make you custom flaps. Rings, intacts for keratoconus or any other rings can be used. For keratoplasty, penetrating, anterior lamellar, or some of the machines can even give you a posterior lamellar keratoplasty. The basic principle is of a photo disruption nature. You have a 1 micron pulse. You can have different machines coming out with different pulse. You can have a different energy there. And when you have a pulse there, hitting on the cornea, it creates a expanding gas bubble of water. And this separates the corneal lamellae. When you stack them together in different ways, like this, and you have one next to each other, you can have this separation of these spots, and you get a resection plane. When you get a resection plane, you can get a vertical or horizontal or whatever way you want. For the laser to go, you need a laser delivery system, which is called a cone, which can deliver at a bright precision, and that's where you get the plane. Each of the spots can be altered. When you have an alteration of spots, the spacing between the spots can be altered. Along with the alteration of the spots, you can also need to change the energy. Just to say that the machine is more like a computer where you can change all the parameters. What happens to the gas, what hits the cornea, is it has to be vented out. Different machines have different ways of venting the gas. This is from FS200. You can see this is a canal. It vents out the gas. The same thing, what happens in a different technology called intralase, the gas actually goes inside. It goes inside, it goes to a pocket, it's called a pocket. So if each machine has got a different way how the gas is vented, because it's very important. There are machines where there is no gas vented, because it vents, the side cut when the cornea is made, it's made simultaneously so the gas can go out. The reason femtosecond flaps are much different, because we all know that the peripheral fibers contribute to the strength, and when you have in a microkeratome, these are the fibers. You don't have a planar cut. You have cut which is which is deeper in the peripheries, thinner in the center, and it again deeper. So it cuts it creates an imbalance to the shape. On a femtosecond cut, you have a much more planar cut. So that means it does not really cut on the same plane in all direction. Now let's look at, we use a very research model OCT called as Bioptigen, which we can use it to study the changes happening on the table. And see, this is actually just when the flap is made. You can see a flap which is cut, and from here to here is the epithelium. This is the only OCT which gives you a resolution of 2 microns, and it can be used on the patient in the OT. And this is actually a retinal OCT, and you can see the healing happening just on the first day post-op. And this is the cut after you reflect the flap. You can see the bed here, and this is on a microkeratome, but it goes sloping. It dips into the cornea like this. Compared to this is very vertical, which does give to the strength of the flaps. And you can see the meniscus-shaped flaps in a case of a microkeratome. And this just shows that the predictability of any femtosecond is very close at 5 to 8 microns compared to the blade, which gives you different shape, different sizing. The one thing which is interesting, we have our optics lab on which when we started studying, we see a lot of report that femtosecond gives good result. But does it give you a good result? Because there is a lot of energy, and there's a lot of energy on the flap itself. So we compared patients who are very happy, 6x6 on your Slenderman liquidity chart, and we compared the post-op. The results were not very encouraging on a femtosecond flap, because on the day 1, the femtosecond flap did have more of edema, and the MTF, the modulation transfer function, was lower on a femtosecond, even though they were seeing 6x6 compared to a microkeratome flap. It did take around 7 days for this to recover. It does mean that the energy itself can change the flap dynamics and cause the vision to take at least a week for it to come. We did a confocal on the same patient. This is what we thought would happen, is actually was shown in the confocal. You can see this is the pre-op, these are the keratocytes, and you can see this honeycomb shapes, all the keratocytes floating around. This is what you would not see in the microkeratome flap. This is what you would see on a femtosecond flap. The reason being that this is an energy and there is water in the flap which takes at least a week for it to go. So if you're trying to study anything on a femtosecond flap in terms of contrast, anything, the first week is not a good idea to study because that's where you have a lot of bias of water in the flap. We also did some biomechanics study to see if this flap actually is better. We used both the machines to study, and we found that there's not much of a huge difference. Only thing is, this is a machine called Corvis which looks at the deformation of the cornea. The only thing we found was in a femtosecond flap, the laser was able to distribute the energy much better than the microkeratome flap. The laser distribution on a femtosecond was better because this is the A2 length. A2 length means the distribution of the energy on the flap. That was the only significant thing which we don't know whether it's really significant. Let me just run through certain important machines which we have. Each machine has got its own positive point. This is from Technolas, Perfect Vision. The advantage here is most of them do have work on the same principle. There are certain advantages with each machine. This can be combined with the femtosecond laser, and it has a curved interface, which means that it gives less energy. You can also do procedures like intracore, which gives you, which is for the presbyopic correction. Intralase been there for many years, one of the most time-tested machines. It can do everything basically, and this was one of the first to get an FDA approval. The FS200, one of the fastest, so-called the fastest in the group now. Again, it's got all the basic features of a femtosecond laser. Multiple, the vent passage is something which is unique to this, where the gas is vented out to a canal, which reduces the opaque bubble layer. And this is how it is done. You can see it's more of a mechanical. The green button mentions here says that the machine is taking care of the control, and this is the flap can be adjusted. Even if you adjust the flap, the sizing of the flap doesn't really change. You can adjust the flap here, and you say vent, and you can see the gas venting out here, and the flap is done within the whole suction on and off time is close to around 6 seconds. And this is when the gas comes out, is called the burp. The advantage of this is connected to your laser machines, the topography machines, so that all the different type of profile, you can change the flap area, because if you're giving this kind of a laser, you don't want the hinge to be here, so your laser is sitting on the hinge, so you can change it according to the way you want. This is again a very small machine from some femto LDV from Zima. It uses, it has a small footprint. That's one of the advantage. Very fast laser, and supposedly it gives very less OBL also in practice. Zeiss has come out with revolutionary technologies. Revolution in terms of all laser LASIK, where you are trying to remove the lenticule rather than trying to ablate, is something which is very unique about this machine. There are a lot of things about lasers, not only making flap, we can go into the beyond flap thing. It can make the tunnels, and this is a tunnel just before I put the rings here. It's very precise depth, and this is a ring which is placed, and this what you see a band is a cross-linking which we do simultaneously, which is happening around the rings. Different types of shapes of keratoplasties can be done, like mushroom, and this is what really differentiate the keratoplasty of a manual with this, because the shape of the keratoplasty is lock and key mechanism, and you can see the perfect seal even on the table. Just this part is what is the sutures. This is what gives fantastic results even on a day one. And this is the manual keratoplasty what we see, and this is 1 month and 3 months on a femtosecond keratoplasty. It's a huge difference in the quality of vision and the way it is done, and even we are putting less number of sutures than before. So there is a learning curve. Opaque bubble layer is still an issue. Incomplete decentered flaps are still an issue with this. Sometimes if you're going too thin, you can have a vertical gas bubble break or a buttonhole, and the biggest drawback of this machine is still the cost. And this is the opaque bubble layer, and sometimes you can still have an incomplete cuts. Thank you.